What if the shadow of drug overdose deaths still looms large, with over 100,000 lives lost each year, hinting at a crisis that's both easing and intensifying in unexpected ways? That's a story unfolding with every statistic, every family touched, and every step toward change. Welcome to Healthy Start, your go-to channel for science-backed tips to live healthier and stronger. If you're new here, hit that subscribe button for Healthy Start and ring the bell to stay updated with every eye-opening video. Today, we're diving into a sobering reality from recent health reports. Overdose deaths remain above 100,000 annually in 2023, showing a slight decline yet revealing stark regional shifts, with reductions in some areas and alarming increases in others. Let's explore what's driving these numbers, why the situation varies so widely, and how communities can respond to this ongoing challenge. It all began with a recent health update that caught attention and stirred concern. A detailed report from a leading health organization revealed that overdose deaths held steady at over 100,000 per year in 2023, a figure that's both a relief and a warning. This marked a slight dip from previous years, suggesting some progress, but the overall toll remains devastating. The data highlighted a mixed picture. 37 regions saw a decrease in overdose deaths, a sign of hope amid the struggle, while other areas faced sharp rises, with notable increases in places like Nevada, Oregon, Washington, and Alaska. This uneven trend paints a complex story of a crisis that's far from resolved, prompting experts and communities to dig deeper into the causes and solutions. The report's findings have sparked discussions, urging a closer look at what's working and what's slipping through the cracks. So, what's behind these staggering numbers? The report points to a cocktail of factors fueling the overdose crisis. Prescription opioids, like oxycodone and fentanyl, remain central players, often misused or mixed with illegal drugs. Fentanyl, a synthetic opioid up to 100 times stronger than morphine, has flooded markets, turning even small doses into deadly risks. Alongside this, stimulants like methamphetamine and cocaine are increasingly involved, often combined with opioids in a deadly mix. The slight decline in some areas reflects efforts like expanded access to naloxone, a life-saving overdose reversal drug, and better treatment programs. Yet, the persistent high numbers signal that supply chains, addiction cycles, and gaps in care are still overpowering these gains, keeping the death toll alarmingly high. Let's zoom in on the regional divide that's shaping this story. In 37 regions, the drop in overdose deaths offers a glimmer of progress, driven by public health initiatives and community outreach. Increased naloxone distribution, training for first responders, and overdose prevention education have likely played a role, saving lives one dose at a time. But the contrast is stark in places like Nevada, Oregon, Washington, and Alaska, where deaths have spiked. These areas report surges linked to rising fentanyl availability, limited health care access, and socioeconomic challenges that deepen addiction risks. The report notes that rural settings, with fewer resources, often see higher rates, while urban centers grapple with drug trafficking networks. This patchwork of outcomes shows a crisis that's both local and global, demanding tailored responses. Behind the data are human stories that bring the numbers to life. Families share tales of loved ones lost to accidental overdoses, often after years of battling pain or mental health struggles. One community leader spoke of a young person found unresponsive, revived with naloxone, but still caught in a cycle of addiction. Another account highlighted a parent's relief at a treatment program that turned a life around, only to see others fall through gaps in support. These narratives underscore the urgency, showing that each statistic represents a person, a family, and a community in pain. The report's findings resonate with these experiences, pushing for action that bridges data with real-world impact. Why are some areas seeing progress while others lag? The answer lies in a mix of policy, resources, and awareness. Regions with declining deaths have invested in harm reduction, like needle exchanges and safe consumption sites, alongside addiction treatment expansion. Public campaigns have destigmatized seeking help, encouraging more people to reach out. In contrast, areas with rising deaths face barrier shortages of healthcare providers, limited funding for rehab, or cultural resistance to addiction services. The report suggests that synthetic drugs like fentanyl, often laced into other substances without users' knowledge, amplify the danger, outpacing local responses. It's a race against a moving target, where success in one place highlights failures in another. The role of healthcare is pivotal. Access to treatment, from detox to counseling, can break addiction cycles, yet many struggle to find care. The report notes that waitlists for rehab stretch months, leaving people vulnerable. Emergency rooms see a steady stream of overdose cases, with naloxone saving lives but not addressing root causes. Doctors are urged to use prescription drug monitoring programs, tracking controlled substances to spot misuse early. Community health workers, bridging gaps between clinics and homes, offer another layer of support, connecting people to resources. It's a system under strain, where every saved life is a victory, but the workload keeps growing. Prevention is a cornerstone of turning the tide. Education campaigns target youth and families, teaching about drug risks and safe disposal of unused meds. Schools incorporate awareness into health classes, while workplaces offer employee assistance programs. The report highlights that reducing stigma around addiction encourages early intervention, preventing escalation. Safe storage of prescriptions and public access to naloxone kits are practical steps, empowering communities to act fast. It's about building a culture of vigilance, where prevention becomes second nature, not an afterthought. The opioid crisis's evolution adds complexity. Fentanyl's rise, often mixed into counterfeit pills, has turned casual use into a gamble with death. The report cites data showing overdose deaths involving synthetic opioids jumped in some regions, outpacing traditional heroin. This shift challenges law enforcement, healthcare, and policymakers to adapt quickly. Illicit drug markets thrive online, shipping potent substances across borders, while testing strips for fentanyl gain traction as a harm reduction tool. It's a cat-and-mouse game, where innovation must match the pace of danger. Families bear the emotional weight. Losing a loved one to overdose leaves scars, grief, guilt, and questions about missed signs. Support groups offer solace, connecting parents and siblings to share stories and strategies. The report acknowledges this human cost, urging mental health resources to complement physical care. Community vigils and awareness events honor the lost, turning pain into action. It's a collective healing process, where support networks grow stronger with each gathering. Looking ahead, the slight decline is a foothold, not a finish line. The report calls for sustained funding, expanded treatment, and global cooperation to curb drug supply. Researchers study overdose patterns, seeking better interventions, while advocates push for policy changes. It's a long road, but every step naloxone in hands, treatment beds filled, education delivered builds toward a safer future. As we wrap up, this crisis demands attention and action. The 100,000 plus deaths are called to keep pushing, learning, and supporting each other. Every effort counts, shaping a healthier tomorrow. Thanks for joining me on this deep dive into overdose deaths. If you found this video helpful, give it a thumbs up and share it with someone who needs to know. Don't forget to subscribe to Healthy Start, hit that bell, and stay tuned for more valuable videos. See you next time, and here's to a healthier future.